For Project 2, we focused on the social structures of substance use disorders within the carceral system. Our thesis is that the carceral system threatens the dignity of individuals with substance use disorder. So to address social structures, we have to define them. So a social structure is a durable, individual-spanning phenomena that enables and constrains actions and interdependent choices. And there are three functionings within social structures, which are rules, representations, and relationships. Structural injustice is when someone's central combined capabilities are denied due to social structures that cannot be justified morally. So first, we're going to define rules that exist within the process of dealing with a substance use disorder and being in the carceral system. So Eastwood defines rules as shared prescriptions and proscriptions, and she says you might think of them as normative representations or representations about actions. They are individual-spanning, durable, and enable and constrain choices, and they can be located on a continuum from norms to laws. Sentencing is one of the rules that impacts the lives of people in prison dealing with substance use disorders. Mandatory sentencing requires that offenders serve a predefined term of imprisonment for certain crimes, commonly serious or violent offenses. This means that judges are bound by law, and these sentences are produced through legislature, not the judicial system. In 2016, mandatory minimums were used less often in federal drug offenses, but continue to result in long sentences for drug offenders. The average sentence for drug offenders convicted of an offense carrying a mandatory minimum was 94 months, more than double the average sentence for offenders whose drug offense did not carry a mandatory minimum. This means that people committing drug crimes are getting higher sentences with mandatory minimums attached. These penalties can have a significant impact on the size and composition of the federal prison population as well. The Controlled Substance Act is a statute establishing a federal policy to regulate the manufacturing, distributing, importing, and exporting and use of regulated substances. It was signed to lay out the framework for the categorization of controlled substances and creates a legal foundation for their regulation. Since this act was put into place, it has not been effective at decreasing drug use, abuse, or overdoses. It has only criminalized people that struggle with it. The Anti-Drug Abuse Act of 1986 allocated $1.7 billion to the war on drugs and established a series of mandatory minimum, which was talked about in the previous sentencing slide, for prison sentences for various drug offenses. As shown in the table, after 1986, arrests for drug violations increased substantially. And while the arrests increased, the problem wasn't solved. There are also current rules in place that deny the rights of people once they get out of prison, especially if they're a felon. This is very apparent in two large aspects of society: when they go to apply for a job again and when they go to vote again. The graph to the right shows voting restrictions by state and how there are many states where anybody who has been in prison is not allowed to vote. This is a fundamental right that should not be taken away. On the top, job applications are another example, and the Ban the Box activist group has been trying to take the question of if you've ever been convicted of a criminal offense off job applications. While banning the box has other outcomes that we won't discuss here, both are very valid problems and rules that exist for people that are newly out of prison. There's also a number of informal rules that exist that disadvantage people with substance use disorders. These kind of overlap with representations, which we'll touch on later, but the main ones are the political agenda to be tough on crime, leading there to be more arrests, but not often leading to decreasing actual crime. Making something illegal also means that policymakers can deny people the most basic harm reduction interventions or treatment options without fear of backlash. So this essentially means that when you make a substance illegal, it makes it harder for people to seek treatment because they're already doing something wrong by having those substances. And they can get in trouble for that. This puts them in more harm. Another informal rule is that laws are meant to stop people from doing things. And and drug crimes are sort of a different aspect of crimes than most other violent crimes are. And then also the public perception of alcohol versus drugs, where alcoholics are always sent to get help, they're sent to rehab, whereas drug addicts get viewed as lazy and unmotivated and having a bunch of other issues where they're not both equally treated as medical issues.
Relationships can be defined as any sustained interaction between individuals. What makes relationships structural? Individuals have interpersonal relationships with others, depending on who is part of the communities that they are part of. Collections of interpersonal relationships combine to form networks. Interacting through these networks creates patterns of interactions, which therefore reinforce the lack of communication between prisons and the public. Because HUD treatment options are not universal across the nation, there is a lack of clarity about what programs are available to incarcerated individuals. A 2023 California Department of Corrections and Rehabilitation report found that although many U.S. jails and prisons provide some form of MAT, it is often difficult or impossible to locate this information directly on the institution's website. When asked how common these life-saving SUD treatments are in prisons, Brendan Solner, PhD, a Bloomberg Associate Professor of American Health in the Department of Health and Policy Management, said, quote, "We don't have any hard data on this question. I would say that it is certainly not the standard of care right now for incarcerated people to get access to these medications." This lack of communication between prisons and the public, including incarcerated individuals with SUD and their families, results in a lack of awareness and knowledge about treatment options, and therefore a barrier to actually receiving treatment. Relationships with healthcare providers in prison. MAT treatments, including administering methadone, cannot be done directly through prisons. Relationships with community partners that are equipped and able to provide MAT are necessary. This means that physicians are limited in the direct care that they are able to provide to their incarcerated patients. With increasing evidence-based research about the success of MAT, there are national recommendations for incorporating MAT in the carceral system. The Substance Abuse and Mental Health Services Administration recommends leadership buy-in and staff who are fully dedicated to implementing MAT programs. National Commission on Correctional Healthcare recommends training existing healthcare and correctional staff on understanding SUD as a chronic illness that requires both MAT and behavioral counseling. Dr. Mark Stern, Chief Medical Advisor of the National Sheriff's Association and National Jail Administration, states, quote, "We recognize from our collective years of experience that implementing withdrawal management cannot be a solo effort by jails. Successful implementation of the guidelines requires community involvement, such as establishing partnerships with hospitals and opioid treatment providers. However, recommendations are not equivalent to implementation. This is evidenced by the dramatically different policies across the states. For instance, New Jersey has successfully implemented MAT and behavioral therapy programs in prisons across 50% of its counties, while West Virginia offers MAT treatment just a few days prior to release and no behavioral therapy, and Mississippi has no provisions of MAT whatsoever.
Representations are schemes of socially constructed categorization reinforced by stereotypes we hold about certain groups. In all but one state, substance use disorder manifested as drug possession is represented as a criminal act. The criminalization of SUD leads to frequent arrests for drug possession, with harsh penalties enforced under the war on drugs ideology. This approach, pioneered by Nixon, fails to address the root causes of addiction and perpetuates a cycle of incarceration. Enhanced sentences for repeat offenses further stigmatize individuals with SUD, hindering efforts for rehab and support. Angel Suarez was an interviewee for every 25 seconds, a comprehensive report spanning from October 2015 to March 2016, where 365 interviews were conducted in 4 states with 149 people prosecuted for drug use. Many of the participants used pseudonyms to remain anonymous, including Suarez. Suarez stated that, "I consider myself an addict and sometimes worry when I'm using, because they search you for no reason. It makes it hard to live life when you're walking down the street watching your back, but at the same time, when you don't have your drug, it makes you sick. Angel Suarez and others with similar stories are forced to choose between going to prison for their drug use or brutal withdrawal symptoms due to the criminalization of SUD. Sarah Coughlin, a social worker and SUD specialist, reinforced this tragic choice between getting treatment and going to prison in a New York Times article. She states that patients are far less likely to talk honestly about their relapses and their struggles with recovery if they think it's going to land them in jail. The criminalization of SUD has forced individuals to refuse treatment out of fear of going to prison, prioritizing freedom over mental health and physical health as well as well-being. Another harm perpetuated by the criminalization of SUD is the acceleration of the Penrose effect. The Penrose effect coins the idea that there is a cyclical relationship between mental health disorders, including SUD, and prison populations and/or engagement with the carceral system. Because of the links between SUD and mental illness, the criminalization of addiction encouraged by the war on drugs accelerates the Penrose effect. This expedites the decline of behavioral health care in prisons while driving population growth in the U.S. carceral system, even as neuroscience is advancing our understanding of addictions as brain diseases. As seen in the flowchart, SUD goes untreated due to a lack of behavioral health care options. In turn, SUD and other mental disorders are labeled as criminal, therefore increasing prison populations and enforcing recidivism.